PhD in medical doctorness. So you're in great hands, okay? You're in great hands. My PhD is in this office. Actually, I just can't show you it. Okay. So yes, sir. Let me get your information first. I'm gonna get your information first. Okay. So what's your name? What's your name? Alright, good job, good job. Okay, and then where's your date of birth? Alright, and then last but not least, what's your address? Alright, and that actually wasn't the last question, my bad. Alright, do you have any medical concerns that I should know of? Okay. Alright, there we go. So I got all your information, so we can get started. I think I'm gonna start you out with the hearing test. With the hearing test. So, just let me check your ears first. I'm gonna check your ears first. How often do you clean your ears? Alright, good. So I'm just gonna look at this one. Alright, everything's fine. I'm not seeing any dirtiness. Everything's good. Okay, good job. That ear looks great. I'm gonna look in this one, okay? Okay, so you do have a little bit of wax in that ear. But that's perfectly fine. Because you're at the doctor, I'm gonna clean it out for you, okay? Before we get started. Just to make sure that you have a, accurate hearing test, okay? Alright, so just hold still. I'm gonna clean this ear out, okay? Okay. Alright. Alright, there we go. I'm gonna look one more time. Let me look one more time. Alright, your ear looks fine. Okay. Let me know if you feel any discomfort. I forgot to do this part. Let me know if you feel discomfort here. Alright, and what about here? Here. Okay, here. And over here. What about behind your head here? Okay, over here. Alright, good job. So I need to take off my glove for this next part. I'm gonna ask you if you hear me tapping or scratching, okay? So I'm just gonna tap and scratch on an object. This water bottle. This almost empty water bottle, okay? Alright. So tapping, good job. Scratching, good job. Okay, so yeah, just tell me whenever you hear me switch. Alright. Good job. Close your eyes. I don't know if I told you to do that. Close your eyes. Okay. Good job. Good job. Alright, we're done with that. You did great. Alright. Now, tell me when you can hear my bracelet. I'm gonna make a sound with my bracelet right here, okay? My bracelet. Okay, just let me know when you hear it stop, okay? Okay. Good job. Good job. Okay, you did great. Alright, so now I'm gonna do the same thing with finger fluttering, but I need you to tell me when you hear the sound start, okay? So it'll sound faint, but just let me know when you hear it, okay? Okay. Good job. Good job. many was that? How many was that? 10. Good job, good job, good job. How many was that? How many was that? How many was that? How many was that? I know I did it a little harder. 12, 12, 12. Good job, good job, good job. How many was that? How many was that? How many was that? How many was that? 16. Good job, good job. How many was that? How many was that? How many was that? How many was that? Good job, good job, good job. Alright, so you passed that one, you passed that one, great. You passed that one, great. Now I need you to tell me which sound is louder, okay? So, this is, oh, hold on. Okay, this is sound one, this is sound one, this is sound one. Okay, and this is sound two, this is sound two. I'm gonna do it one more time, one more time. That's sound one, and then this is sound two. Which one sounds like it's louder? Sound one, good job, 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 good job. Alright. Now I'm gonna pull out this case. This case. If you know what's in here, real. Okay. Alright, and now I'm just gonna test your ability to recognize tones, okay? So I have two different tuning forks, and they make different frequencies, and I need you to tell me which one is lower, okay? Which one is lower? Alright. Oh, I forgot that. Okay. So, this is option one, this is option one. Alright, that's option one, that's option one. Now we have option two. This is option two, okay? Which one sounds like the lower pitch frequency? Option two, good job, good job, good job, good job, good job. Alright, so for the next test, I'm gonna whisper in your ear, but I'm also gonna be making a noise. So I need you to tell me what word I'm whispering in your ear, but it's gonna be a little harder because, you know, I'm making a noise at the same time, okay? Alright, so, this is the noise, but it'll also be that, okay? Alright. So let's get started. Sparkle. What was that? Sparkle, good job. Alright, now. Jelly bean. What word was that? Jelly bean, good job. Crispy. Alright, what word was that? Crispy, good job. Velvet. What word was that? Velvet, good job. You're doing really good. Alright, last one. Coconut. What word was that? Coconut, good job. You did great. Alright, so we're done with the hearing part. I'm gonna put on my glove for the next test, which is the touch test / sensation test, okay? So, first things first, I'm gonna touch your face in like various parts. I need you to tell me if you can feel it, okay? Alright, so we're gonna start now. Did you feel that? Alright. Did you feel that? Okay. Did you feel that? Alright, good job. Did you feel that? Okay. Now I need you to count how many times I'm touching your face. Alright. So pretty simple, just count. Okay. How many times was that? 13. Okay. How many was that? Yeah, okay. Yeah. Good. How many was that? 11. Good job. How many was that? Good job. And last one. How many was that? passed that test. You passed that test. Now, I have three different materials I'm gonna touch you with. Okay, wait, what's that one? Okay, so I have metal, plastic, and then where's the cotton? Oh, cotton. I have metal, plastic, and cotton. All right. So what I'm gonna do is touch you with a different material. I need you to tell me what I'm touching you with. Okay. It should be very, 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 very easy. Okay. All right. So close your eyes. 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 Okay. Now, what am I touching you with? What do you think that was? Plastic. Good job. Good job. Good job. Good job. All right. All right. What about now? What about now? What was that? What was that? What was that? Metal. Metal. Good job. Good job. Good job. All right. What about now? What was that? What was that? Plastic. Plastic. Good job. Good job. What was that? What was that? What was that? Plastic. Plastic. Good job. Good job. Good job. Good job. All right. And what about now? All right. What was that? What was that? Cotton. Good job. Good job. Good job. What about now? What about now? Metal. Metal. Good job. Good job. And what about now? What about now? Cotton. Cotton. Good job. Good job. All right. You did good with that. You did good with that. You did good with that. Now. I'm gonna do the sharper tool test on you again with this tool. So this is the sharp side. This is the sharp side. I'm gonna touch you with it. All right. And then this is the dull side. Okay. So just let me know if I'm touching you with the soft or dull side, okay? Or with the sharp or dull side, okay? What was that? Sharp, good job. Dull, good job. Dull, good job. Dull, good job. Sharp, good job, good job. Dull, good job. Sharp, good job, good job. Sharp, good job, good job. Dull, good job. What was that? Dull, good job. And last one. What was that? Sharp, okay. Now we're gonna do the same kind of thing, but I need you to tell me if it feels the same or different. So I'm gonna tap you. I'm gonna do it in two places, so like your forehead and your chin. And I need you to tell me if it feels like I'm touching you with the same thing or something different, okay? Alright. Alright, did that feel the same or different? The same. Good job. Did that feel the same or different? The same. Good job. Did that feel the same or different? Different. Good job. Same or different? Same. Good job. The same or different? Same. Good job. Same or different? Different. Good job. Alright, now I'm gonna do your cheeks. So the same or different? Different. Good job. The same or different? The same. Good job. The same or different? The same. Good job. The same or different? Different. Good job. And last one. The same or different? The same. Alright, good job. So you did that. You did great. Now I'm gonna test your reflexes, so hold on. Let me get the reflexer. Alright. So give me your arm. Okay. Alright, good job. Let me see the other one. press it down, but try. Alright, good job. Alright, so your mouth looks fine, Your mouth looks fine. So now we can move on to the vision tests. Okay, so I have this paper, and I'm gonna draw letters and numbers through it with the lightsaber. I need you to tell me if you can see the lightsaber, what color it is, and also what letter I'm drawing, okay? So just let me know whenever you see it switch colors. Alright, so what colors is this? Okay, good job. What letter is this? What letter is that? 4. Good job. I mean, number. Yeah, okay. What letter is this? S. Good job. Alright, what letter is this? What letter is that? T. Good job. Alright, what is this? What is that? 8. Good job. Alright, now I'm gonna do a short word. Okay, so just tell me if you know what word I'm spelling out. I'm gonna do it one more time. Do you know what word that was? It was C. Good job. See ya every day. Alright. Okay, now. Next word. A little bit more. Alright, I'm gonna do it one more time. What word was that? Tree. Good job. And I'm gonna do one more. Alright. Alright, one more time. Alright, what word was that? Bad. Good job. Alright. So, yeah, I didn't change the color of the lightsaber, but that's good. I mean, that's fine because we're gonna do another color test, okay? So I have this LED remote right here. Alright, and I just need you to tell me what color I point to, okay? Or what color I land on with my finger. Alright. What color? Purple. Good job. Alright. What color? Like a bluish teal. Good job. Alright. What color? Pink. Good job. What color? Yellow. Good job. Alright. Orange. Good job. And one more. Actually, no. I'm gonna do a couple more. This one. Green. Good job. Another letter probably gave it away. Alright. This one. Blue. Good job. Alright. This one. Darker blue. Good job. Alright. This one. Green. Okay. Good. And one more. Red. Good job. Okay. So yeah, you can see colors fine. You can see colors perfectly fine. Alright. So next. I have this light and I want you to follow it, okay? So oh, hold on, it's too bright. I'm trying to get it dim. Okay, that's not dim. That's gonna have to be dim. Alright. So just follow the light. My foot's falling asleep. Okay. Alright, just follow the light. I know it's kinda bright, but you gotta do what you gotta do. I know. Okay, now I'm just gonna make a distraction, but just keep following the light, okay? Just keep following the light. Alright, just keep following. Yeah, just keep following the light. Just anticipate where it's gonna go by my finger, okay? Alright, good job. Okay, you did great. You did great with that. Alright, so now I have two lights. Two lights right here. Hold on, I don't want to blind you. Okay, there we go. I got it to be dim. So I have two lights. I just want you to look at my nose. Look at my nose and ignore both lights. Okay. Look at my nose and ignore both lights. Simple enough, right? We'll see. We'll see. We'll see. All right. Just keep looking at my nose. 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 Alright, good job, good job, good job, good job. Just keep looking, just keep looking, just keep looking at my nose. If you can't see it, just look where it should be, okay? Just look where it should be, just look where it should be. Okay, good job, good job, good job. Look at my nose. I should probably scoot back a little bit. Alright, look at my nose, keep looking, keep looking. Keep looking, keep looking. Are you sure these lights aren't distracting? Okay, okay, you did great, you did great, you did great. You did great, you didn't get distracted, even though I tried my hardest. I tried my hardest to distract you. Okay. I tried my hardest to distract you. Okay. So. Now I have this eye chart, I have this eye chart. I have this eye chart, but I'm gonna have to ask you to read the letters upside down, okay? So, still read. Just read them the right way, but upside down, okay? Okay, okay, okay. Yeah. Alright, so, can you still see it from here? Yeah, alright, good. What letter is this? What letter is this? What letter is this? E, good job. What about this one? What about this one? Good job. What about this one? Alright, what about this one over here? Good job, good job, good job. And this one in the middle right here. B, good job. This one. C, alright, and can you read this whole line? Can you read this whole line? Read this whole line. Good job, good job, good job. Alright, what letter is this? What letter is this? Can you read this one? Can you read this one? What about the one on the end? Alright, can you read the letter in the middle of this line? Read the letter in the middle of this line. There's none. That was a trick question. Okay, good job, good job. Read the letter that's in the middle of this line. It's in the middle of this line. Good job, good job, good job. Good job, good job, good job. Alright. Alright. You did good, you did good, you did good, you did good. Wait, can you read the bottom one? I gotta see. Can you read the bottom one? Can you read it? If you can, you have really good vision. I'm not gonna lie. Okay, okay, good job, good job, good job. Alright. Okay, there we go. Now. We back with the same tongue depressor that I put in your mouth, okay? So, what I need you to do is tell me if point A or point B is closer. I'm gonna just fix it to your vision like this, okay? And I'm gonna touch two different points. I need you to tell me which one's closer, okay? This is point A, and this is point B. Which one's closer? Point A, good job. Point A and point B, which one's closer? Point B. Point A, point B, which one's closer? Good job, good job. Point A, point B, which one's closer? Good job, good job. Point A and point B and point C, which one's closer? Point C, good job, good job. Point A, point B, and point C. Good job. Point A, point B, and point C. Good job. Now tell me which one's farther, which one's farthest, okay? Point A or point B. Good job. Point A, point C, or point B. Good job. Point A, point B, or point C. Good job. Point A, point B, or point C. Good job. Point A, point B, or point C. Good job, good job, good job, good job, good job. Alright, you did great, you did great, you did great, you did great, you did great. Now, we gotta wrap this up. We're almost done, I'm just gonna I have this, oh, we didn't see that. I have this not palette, sorry. Alright, what does it smell like? What does it smell like? What does that smell like? Lemon, lemon, lemon. Good job, good job, good job, good job. Okay, okay, okay. Now, now, now. What does it smell like? What does it smell like? What does it smell like? Good job. Good ball. Yeah, you can take your time. You can take your time. What does it smell like? Like a woody kind of fresh cut grass. All right, good job, good job, good job, good job. And last one, last one, last one, last one. What does it smell like? What does it smell like? What does it smell like? What does that smell like? Vanilla, vanilla. Good job, good job, good job, good job. Right now, now, now. What I need you to do is just smile, just smile. Yeah, I gotta check your facial conditioner. Smile. All right, good job. Now frown, frown, frown. I'm not a good frowner. Alright, good job, good job. Now flare your nostrils. Flare your nostrils. Alright, raise your eyebrows, raise your eyebrows. Okay, good job. Now we'll try to resist the pressure that I'm putting on your head, okay? Resist the pressure, resist the pressure. Good job, good job. Now I'm gonna put some pressure on your shoulders and I need you to resist it, okay? Resist it. Resist it. Okay, good job, good job, good job. Now, for the last test, what I need I'm gonna give you some, what are they called? Flavors. I don't know why I keep having brain farts. Some flavors, okay? I'm gonna give you some flavors off of my palette here. And honestly, just tell me what it tastes like. Alright. Just gonna scrape some off. Okay, here, open your mouth, open your mouth. What does that taste like? Yeah, you can take your time, take your time. Chocolate, good job, good job, good job. Alright, now what does it taste like? What does it taste like? What is that? Like a minty peppermint smell. Yeah, good job, good job, good job. Alright, and we're gonna do another one. The thunder's on my end, by the way. Alright, what does it taste like? What does it taste like? What does it taste like? Like buttery popcorn. Yeah, yeah, good job, good job, good job. And last one. Okay, what is this like? Coconut. Yeah, good job, good job, good job. Alright, so we're all done. You passed. Actually, you did better than I thought you would do. I'm not gonna lie, you did better than you did last time. So, yeah, your cranial nerves are all in working order. They're actually better than in working order. They're in superior order. Okay, but yeah,